let the people in as soon as they get there.
Okay.
We can wait just a moment, please, for staff to get in.
All right. No, I was on the phone with my kids, my daughter, my grandchildren in England. So I didn't eat lunch. I talked to my kids instead.
All right, our staff is here whenever you're ready, Chair Schrader.
Let's move it ahead. Okay, let's get started, Gary.
All right, Commissioners, Chair Bernard is going to be out this afternoon, so Vice Chair Schrader will chair this meeting, and the other commissioners are present. We have a policy session. This is a performance clackamas update. This is your third update now on your board goal of, oh my gosh, it's ensure safe, healthy, and secure communities. Forgive me. So an update, we have staff from Health, Housing, and Human Services to present. And this is an informational session only, but to help you achieve several goals under that board priority. So we have Brenda Durbin and Vahid Brown. Whichever one of you will start, please go ahead.
Thank you. This is Vahid Brown. Good afternoon, commissioners. I am here with Brenda Durbin to present you with an update on progress related to two of the county's strategic goals. Reducing chronic homelessness, as evidenced by 2023, a 30% reduction in the number of people experiencing chronic homelessness in the county, and a 30% reduction in the same time frame of the number of children and youth experiencing homelessness in the county, as defined by the numbers of those two different or three different populations of folks experiencing homelessness as they appear in our coordinated housing access wait lists. So those are the two goals that we're going to present our update on. There is an additional slide that was provided regarding the metrics related to those reduction goals. I don't know if we can display that, because I wanted to speak to the baselines from which we are defining the 30% reduction.
So either I can share the information, or I made it available so that you all can share your screen as well.
Okay, and I'm attending by phone, so I'm not able to share screen.
Christina, would you share it, please?
Thank you. And if the commissioners have it in their packets and would just like me to walk through it, that I can do that as well.
I'm trying to pull it up, and it's working against me, but I will be just 1 second.
So while we're doing this, Vahid, I did review the packet a couple days ago, and I saw the charts with the year, this year, last year, and with the number of kids that were homeless and so on, and seeing that reduction. So in your presentation somewhere this morning or this afternoon, if you could at least talk to one point, and that is that the North Clackamas School District had reported that about a year ago or so that there were like 1,400 homeless kids in I don't know if it was the district or the county, but if you could speak to that number and not being reflected in these numbers you have here on in the PowerPoint.
Sure. So yeah, first of all, Commissioner Savas, since we have it up now, so the baseline numbers from which the county is going to be tracking our progress towards meeting these goals are on the left side of the screen. So the implementation team chose 2019 as the year that goal was updated as the point to kind of define our starting point, our baseline. And those are broken out by the numbers of chronically homeless people who were on wait lists in 2019, families with children who were experiencing homelessness on wait lists, and youth under 25 experiencing homelessness. Those categories are, they overlap. So there could be some of those 243 families with children could be also experiencing chronic homelessness. And the same for youth. There could be youth. Some of those 55 households that are youth that are experiencing homelessness could also be chronically homeless. So there is some overlap amongst the categories. The school liaisons, Commissioner Savas, that gather information about students experiencing homelessness. A few things. I think that their definitions are not the same as kind of other definitions used in other kinds of ways of measuring homelessness. The point in time count, the coordinated housing access. I think that the homeless liaisons may identify students who are doubled up as experiencing homelessness in their reporting, and they aren't going to appear in our coordinated housing access list as literally homeless. But yes, there is a dire situation with regard to student homelessness across the state and in Clackamas County. Before I move on, I don't know if I've answered your question, so let me just pause.
Well, I appreciate that. I don't think today's the place, obviously, but if you could look into that maybe, for example, if the means of which the school district acquires that information is different, and I'm sure it is different than the point in time count at which we've gathered the information. I'm wondering if we can at least make sure that the information we have is either, well, you kind of already have that in there. You already kind of mentioned that, but in the point in time count. But I'm just kind of wondering how we going forward in the next year or so, and when these things pop up, when I hear 1,400 kids and we're saying there's 200 or 250 or whatever the number may be, that's a pretty big discrepancy. I'm not saying that one's wrong. It's probably the means in which they gathered the information. So what do we actually put out there or convey out there when we talk?
Yeah. And this the number of families with children that are experiencing homelessness, that's a number of households. So those are at least double that, right? So there's at least one adult and one child in those households. So that's at least around 500 at the very least. And many of those households have more adults and children in them that are experiencing homelessness. So that's a number of households. So I think thinking about the number of children in those households is going to be much closer to the picture that the school districts are seeing. But yes, I have taken note of that, Commissioner Savas, and we will look into that. The second column on the slide, who was served, indicates the households in each of these categories: chronic, families with children, and youth, that were served in our homeless housing programs from the summer of last year to the summer of this year. You'll see that 191 households that were chronically homeless are served in homeless housing programs, 199 households of families with children, and 25 households that are youth only. And then on the right is where we are right now. So as we move forward with tracking the progress on these goals, that right-hand column is where we're going to hope to see these continued reductions in the numbers of people experiencing homelessness in these categories. And the good news is that we're already seeing reductions, as you can see, and that's due to some new resources that have come to the county. And there are a lot of new resources coming to the county in the future that will really help us to drive us towards achieving these objectives and these goals. I think we're in a good place to do so. You'll see that there's a significant reduction in the number of chronically houseless households from the wait list in 2019 to now. That's due to a number of factors, not simply permanent supportive housing programs. So there were a significant number of new placements into permanent supportive housing, but we also had the investment from the Kaiser Hospital System in the region, the Metro 300 vouchers that allowed us to serve 80 families experiencing homelessness. The Clayton Moore Commons is new resources for housing veterans. We had new VASH vouchers come to the county and new mainstream vouchers in our housing authority. So there's a number of factors driving that significant reduction. The bottom column or the bottom bar are permanent supportive housing. PSH is for permanent supportive housing inventory. In 2019, that was 267 units. Right now, it's 264 units. That net reduction is largely due to a program that was permanent supportive housing, because their source of funding changed, transitioned into becoming a transitional housing provider. So we lost some units in permanent supportive housing in that program. That program is still serving people experiencing homelessness, but it's not part of our permanent supportive housing inventory anymore. But we also gained some units. Not all of them are physical units. So permanent supportive housing units on this slide reflect both physical units that are dedicated to, as permanent supportive housing in a program like Chez Ami or Clayton Moore Commons, but it also reflects vouchers and services that follow a person to wherever their tenancy might be, like shelter plus care. So we did increase the number of shelter plus care vouchers available to folks. So there were some losses and some additions, but not a hugely significant change at this time. So that's sort of illustrating the baseline and how we're moving forward and what we're going to be looking at in terms to track our progress in housing these communities, housing these folks in our communities. And now I want to turn back to the document, the update document, and just kind of walk through some of our key strategies and so forth. So as I said, the successes that we've had in reducing these numbers already and will have in the future largely are due to some new resources that are available to us that are really aligned quite specifically with these goals. So first of all, the permanent supportive housing resources will be able to be significantly expanded because of the supportive housing services measure passed by the voters in Metro in May, and the affordable housing bond, the Metro Affordable Housing Bond, which is well underway, and in which the Housing Authority is ahead of schedule in developing units. So those will be incredible resources to address globally homelessness within the county, but specifically for chronic and youth and children. We also have youth-specific resources that came to the county in 2019 in the form of the Youth Homelessness Demonstration Program. This is new HUD funding coming to our continuum of care that will be ongoing. It's significantly expanded our continuum of care's resources and will be developing a youth-specific homeless services continuum to address the needs of those youth. As part of the supportive housing services measure implementation and in work that we have already been doing in the past several years, we're expanding the network of community-based organizations that provide housing and homeless services in the county. Our work in the next years with the support of the supportive housing services measure will have a focus on culturally specific providers and expanding the capacity of our ecosystem of homeless service providers to meet the needs of communities of color. Also related to the supportive housing services measure and our other ongoing rent assistance and housing programs is kind of continuing to use best practices in providing wraparound services to people in addition to housing support. And we've come to see some really promising successes in the use of emergency shelter as a doorway to permanent housing. You know, the experience of Clackamas County with emergency shelter has largely, I think, been the severe weather shelters over the past several winters, where the resource is really a life-saving night out of the cold, but not necessarily a next step after that person who's experiencing homelessness leaves the church or the service center or whatever it is. When we had COVID dollars, federal funds related to COVID to provide shelter to people experiencing homelessness that were highly vulnerable to a severe infection, more than half of those people were referred from their motel stays that were emergency shelter stays to permanent supportive housing, to permanent housing units. And so we're going to continue to, in the development of emergency shelter with the supportive housing services dollars, approach that with the same focus of shelter should be not only short-term, but it should end with housing. And we're also planning for the housing and homeless services needs throughout the county. Of course, the supportive housing services measure is focused in the metro areas of the county. So we are already underway planning for how investments from other sources of funds can be placed to meet the needs of people experiencing homelessness and housing insecurity throughout the rest of the county. The metrics I've kind of already gone over, the baselines and our permanent supportive housing inventory. One other related metric on our goal form or document here is long-term success in maintaining housing. And this is a HUD measure that we report. And as you know, the county is consistently ranks among the best in the nation in our continuum of care applications for federal funding every year. And we have very good system outcomes with respect to long-term success in maintaining housing. In permanent supportive housing programs in Clackamas County, 96% of people maintain long-term success. Overall, our system, our entire system of homeless housing services has a 95% success rate in long-term maintenance of housing. Turning now to activities completed to date related to these strategies. As I mentioned, the Metro 300 program, which was an investment from Kaiser in the region to house 300 households of people experiencing homelessness with a focus on older adults and people with disabilities. 80 households are being housed in Clackamas County through this program. We are almost at full utilization. At the moment, there's 5 unclaimed vouchers in that program, so we are on schedule to achieve that mark by the end of the year. The Supportive Housing Services Local Implementation Plan, the preparation for that plan is underway. We have some partners working with us on our community engagement with communities of color. That's the Unite Oregon and the Coalition of Communities of Color, as well as the Corporation for Supportive Housing, CSH, is a consultant working with us in engaging with other advisory boards and community groups, and will provide technical assistance in the writing of the plan. We also, with respect to the Metro Affordable Housing Bond, have already awarded resources for 4 projects, totaling 461 units that are in development. 201 of those units are for 30% area median income and below households, which is more than half of our goal. So our target for the development of units at 30% AMI below is that 40% of our total developed units will be for households making 30% of area median income or less, and we are more than halfway there already. Project-based vouchers, that's PBVs. We have 173 project-based vouchers awarded to support units of affordable housing to households of 30% of area median income and below. As I mentioned, the Youth Homelessness Demonstration Program, they have completed in their year 1 work a coordinated community plan and have granted 2 grants to fund projects already, one in diversion prevention and access, and a program for a joint component of transitional housing and rapid rehousing. So the youth homelessness system is already being stood up by the YHDP group. They are supported by a youth action board, an amazing group of young folks in Clackamas County with a number of them with lived experience of homelessness that are providing their expertise to guide that work. We have integrated a number of new domestic violence providers into coordinated housing access, new preference vouchers for Section 8 for people experiencing homelessness as a move-on strategy out of permanent supportive housing. Supportive housing doesn't need for all households to be permanent. Not all people experiencing homelessness, including people who have experienced chronic homelessness, need intensive services forever. Some do. But for those that don't, we have a move-on strategy to provide ongoing deep rental assistance and support, but not the intensive level of support that we refer to as permanent supportive housing. And we have, as I mentioned, we've already engaged in contracts with providers to assist us with our community engagement work for the plan. Oh, this is different. We have also engaged with Unite Oregon and the Coalition of Communities of Color to help us develop a plan for meeting the needs of households outside of the metro area. So once that contract with them is done to inform the local implementation plan for the supportive housing services measure, they will be working to help us develop a plan for the rest of the county. And then the activities plan for the fiscal year, much of these are milestones in the strategies and activities I've already described, in particular the supportive housing services measure, the youth homelessness demonstration program, and the development of new units with the affordable housing bond. I won't kind of go over each one of these, but these are the kind of the projected milestones in the development and kind of the progress of each of those projects and new funding resources. And just kind of calling out some of the things that are working well across the county with respect to ending homelessness for these populations. In coordination among H3S divisions and across county departments was called out by a number of our implementation team members. I think that that's some of the success we've had in reducing the number of people who are waiting for support, who are chronically homeless, who are experiencing chronic homelessness, is due to the increased coordination between our homeless housing programs in coordinated housing access and in social services with the housing authority, and really kind of marrying housing authority resources with the coordinated housing access program. I already mentioned the shelter to housing strategy that we saw success in with our COVID-19 motel shelter program in the summer. The Veterans Village is a similar success. That is, the Veterans Village is emergency shelter in a sense. It's a transitional shelter community for veterans experiencing homelessness, and it's been extremely successful in getting veterans experiencing homelessness into permanent housing. The Youth Action Board, as I mentioned, is meeting, and the YHDP, the Youth Homelessness Demonstration Program Planning Group, is also continuing to meet and guide that work as a entirely new continuum of services for youth experiencing homelessness is stood up in the county. Barriers and challenges, of course, COVID-19 and the wildfires are barriers and challenges to everything the county is doing, and with respect to all of our goals. The same is true for with the work to provide people with housing. The wildfires displaced a number of people, displaced programs, staff that work on providing people with services and housing were had to evacuate their homes. And of course, COVID-19 has made case management and outreach and in-person service delivery much more complicated. Another challenge that we are working to overcome is that the supportive housing services funds, which will really be a tremendous resource for the county in ending homelessness in the metro areas, is limited to the metro boundary in terms of how it's used. So that challenge is one that is causing us to engage in some deep planning efforts to meet the needs of our residents that do not live in the metro boundaries. COVID-19 and technological challenges. This is something that was really called out by the folks involved in the Youth Homelessness Demonstration Program. And then really the capacity related to the supportive housing services measure. It's a very large resource coming to the county, tens of millions of dollars a year to provide housing and supportive services. And we really need to grow our ecosystem of community-based organizations that are working alongside us to provide housing services. So that'll be a challenge that the supportive housing team and the housing authority will be working on over the next year. And we do not recommend any changes to these goals at this time. And with that, I will turn it to the commissioners for questions.
You're on mute, Chair Schrader.
I don't have the ability to see hand raised, so I'm going to go ahead and let
Stina.
I can definitely call it out. Commissioner Humbertston has his hand raised, and then Commissioner Fisher.
Okay.
So in looking at your statistics at the end of your presentation, Vahid, you look at families with children, 243 households, 199 served, and yet still 201 households still waiting. Obviously, the number of people that are families with children that are homeless has continued to grow. The same thing applies to youth, only down by 4. So what would you say is accounting for the increase in homelessness?
Well, up to now,
do we have some specific information? Because, out there in some of our more rural communities, more conservative areas, the automatic assumption seems to be that everybody is smoking dope or in some other way on drugs and their own worst enemy, I guess you'd say. Mm-hmm. And yet, I know from you that that's not the case. So really, what is the case?
Well, we know we've, from the point in time count year after year, from surveys that we've done, from research that's been done in the region and in other West Coast cities, that the number one reason people are homeless is they can't afford housing. They aren't able to pay the rent. And so that is why we see an increase. There are more people coming into our wait lists than going out, right? Currently, that's going to change with our new resources. That's the goal. That's what gets me out of bed every day. But yes, there continues to be a housing crisis and a housing affordability crisis. People are wages have not increased at the rate of rents. So folks who are renting in Clackamas County, a far too large a proportion of those are extremely rent burdened. So they're a hospital bill, a car accident, a medical emergency away from losing their apartment, losing their housing, and becoming evicted. The economics have not been improved in 2019 by COVID and large numbers of our residents being unemployed. I think that we will see the numbers on the right go up somewhat before they go down because of COVID-19. The economic impacts are going to really hit struggling families very hard. There are a lot of complicated reasons for people becoming homeless, but overall, the number one reason, Commissioner Humberston, as you know, is the economics. It's that people are not making enough money to afford the rent. And yes, people experiencing homelessness, some of them have substance use disorders. Some people experiencing homelessness, their homelessness is caused in some complicated way because of their substance use, right? But that it's not the leading driver. The reason these households with children are living in a van is because they can't afford the rent.
Do we have any specific statistics as to what percentage of people are homeless as a result of drug and alcohol abuse versus those who began doing that because of their economic situation? They became homeless, and I've heard that the statistics show that within 6 months, if they don't have a substance abuse problem, they're highly likely to do so if they don't get shelter.
Right, and I think a similar chicken and egg sort of thing occurs with respect to mental health, right? That experiencing homelessness is extremely traumatic and damaging to your health, including your mental health. So people experience a deterioration of mental health the longer they experience homelessness. And it's once, when we meet someone who's been homeless for a long time and they have a severe mental illness, it may appear, that person is homeless because of their mental illness. But it's often hard to disentangle, which came first, right? And it's the same with substance use disorders. I have looked, Commissioner Humberston, over years and answered the same question at different times. There are statistics on the rates of substance use and alcohol use disorders among people experiencing homelessness. With respect to and this is kind of national data from the federal bureaucracies like SAMHSA, the Substance Abuse Mental Health Association or Administration. With respect to the overall population of people experiencing homelessness, there is not a significant divergence in the rate of substance and alcohol use with respect to housing status. So put that another way, there are people in our communities with substance use disorders. About as many of them are housed as aren't, right? Does that make sense? So there's not a significant divergence that's notable just with respect to housing status. That changes when we look at some subpopulations among people experiencing homelessness. Veterans who are chronically homeless do have much higher rates of substance use disorder, right? So do some subsets of the chronically homeless population. But looking overall, it's not a one-to-one. It's not like someone with because obviously people who there are neighbors and friends and family who live in homes and apartments have substance use disorders, right? So the rates aren't significantly divergent. The last time I looked at the SAMHSA data.
So one final question. So could you say that a particular majority of people are homeless specifically as a result of economics, and another specific minority are homeless as a result of their substance abuse? Do you have anything that relates to that?
Yeah, I mean, I think we ask that question in every point in time count, and we asked it in the Springwater Corridor Survey. So those
Yep.
rates of those are self-reported, causes, but that is our best data. I mean, we don't really have a better way to get at that. So yes, Commissioner Humberston, in every point in time count, we have the statistics on the rates of how people characterized the cause of their homelessness. Obviously, as you know, inability to afford the rent and evicted and job loss are the top. They're the top by far. Substance use, mental illness, domestic violence, those are in the top 10. But the leading cause of homelessness amongst everybody is an inability to afford rent, job loss, or eviction. Those are reported as the cause of homelessness by people experiencing homelessness at far greater rates than any other cause. And I can quantify that for you from the point in time counts if you would like.
Yeah, if you could give me a one-page list of the top 10. I know you've given it to us before. I don't know where it is anymore. But I would appreciate having that top 10 list just real quick and dirty, because there's people that need to see that and understand what's going on. And unfortunately, there's so much misinformation out there and garbage on the internet that's not accurate. So any chance we get to put out accurate information would be helpful.
Fahid, let's make sure you get that to all the commissioners. That would be a good idea. Be a good thing.
Yep. Thank you very much.
So I know Commissioner Fisher.
Thank you, Chair Schrader. Vahid, thank you for presenting. And Brenda, it's nice to see your face. I just want to acknowledge all this incredible work in the midst of a pandemic, in the midst of the wildfires, because I know firsthand, I'm sure my other commissioners know as well, that so much of the effort, time, and just energy had to go into dealing with the emergencies. So it's not so easy when you're in the midst of the emergency to be doing this thoughtful planning. So really kudos and hats off. I love seeing it all on paper this way. It's like, wow, there's so much that has been going on, and it's really phenomenal. We as commissioners get to say, this is a concern in our community. Now this is what we want to do. Now go do it. And it's kind of fun to be able to do that, but it's super great to see that we actually have a pathway through. I did have a couple of questions that I need to either be reminded or just updated. So the Metro 300 project through Kaiser, I think that was like $5.2 million. And then that money, for a lot of it is rent assistance, and that will expire. Do we know how long that will be and what the plan is to assist those people when that money is no longer available?
Yes. It was a 1-year commitment. So the Metro 300 rent assistance program was meant to provide 1 year of rental assistance. So if if a family is leased up on Metro 300 today, Metro 300 will pay their rent for a year, or their portion of the rent in the subsidy for a year. For about a quarter of Metro 300 families, so households that were housed under Metro 300 vouchers, we have already begun transitioning them onto housing choice vouchers with the Housing Authority. So that will be an ongoing rental assistance for that quarter of those households. The rest of them, if they are unable to maintain their own housing and their rental costs and so forth independently, they will be prioritized under the Supportive Housing Services measure for long-term rent assistance.
Excellent. Thank you for that. Another question. So just the data that you have as the baseline from the coordinated housing access, those people are people that have called us and that are on a list and that have asked for help.
Right.
Do you have any estimates? And I don't know if you do, but I'm just curious. And if you don't, that's okay. It's kind of hard to get all the data. But for those that have given up on asking for help and are not on any of our radar, do we have any idea of how many people there are?
No, that is a known unknown, right? To use that phrase. And that's something that is a kind of top of mind for all of us that are working on supportive housing services measure implementation. Is we need a better sense through coordinated outreach, right? So you remember in 2016, Health, Housing, and Human Services conducted a survey of people experiencing homelessness that lived on the Springwater Corridor Trail. And, the vast majority of them were not in our coordinated housing access wait lists. At that time, we learned that coordinated housing access became much more mobile. Folks from coordinated housing went out to the Clackamas Service Center on a regular basis to rectify that. But there may be similar pockets in other parts of the county where people have not called us. We have not managed to connect with them. And we aren't going to until we have an adequate outreach capacity, which we have not had. And so grappling with what are the true numbers will be a big part of our kind of, year one, I think. I mean, the plan is still in development, but yes, I think the answer to your question is we don't know and we need to know better.
Well, it's also when you don't have the services to offer people, people won't apply because why? They're going to be years and years and years on this list, right?
Yep.
So it doesn't, I can see why they wouldn't apply. So I'm really fascinated about the youth board, and I would just love if you can give just a little more information about that. How many youth are on the board? Where do the youth come from? I know you talked a little bit about it, but I'm just fascinated. I don't know if I can just be a fly on the wall in one of those meetings just to hear perspectives, if that's something that is possible. But I'm real interested. So
yeah, it's I'm going to be meeting with the Youth Action Board soon for kind of engagement around the supportive housing services measure, and have been a part of the Youth Homelessness Demonstration Program Strategic Planning Group, but I haven't actually met the YAB myself yet. I know there's 10 youth on the Youth Action Board. Abby Ahern and Raina Smith-Roller are staff that in Health, Housing, and Human Services that staff that. I think they would probably welcome your interest in these questions, so I will make sure to connect you with them. I've heard only amazing things, and I have met some of the Youth Action Board members because they're part of the planning group, and they're amazing.
thank you.
Thank you, Commissioner.
So I have my hand up, so I'll just jump in if that's all right. Appreciate all the
To the door very quickly. I'll be right back. But you were the person I was going to call on next. So let me take care of whoever's at my door.
All right. So Vahid, appreciate everything you do. I know it's a difficult work at times when you see people in difficult situations. I agree. I know that through the number of point in time counts that I've been involved in over the last 6-8 years or so, economics is usually a part of that. But I get concerned sometimes when people want to distill it down to the silver bullet is a certain wage, a living wage, for example. And it's very, very sad when someone spends their whole life, raising a family, paying taxes. They lose their spouse from a death. They're 80 years old, and they're living on Social Security, and they can no longer afford to stay where they're staying. You're not expect them, number one, to get a full-time job. You're not expecting that a wage is going to help them because they can't get a job in the first place. So there's a lot of situations where people maybe only get a part-time job. Well, the minimum wage is not going to help that person, even if you make it $20 an hour. So, I think people want to grab on to sometimes these silver bullets, and it's actually economics, socioeconomics is extremely complicated. And, we're not going to solve it or delve into it, but that is one thing I think we got to better understand it. For example, why do people drive or buy a home or rent an apartment or a home 60 miles away from the metro region so they can live. They live because it's affordable, because their rents went up here, right? The anomaly is the rents are going up faster and disproportionately than anything. The minimum wage isn't falling. The minimum wages in Oregon is creeping up. It's increasing. And the other argument was the minimum wage designed to be a living wage? Well, from a person who was a kid that had 3 jobs at the same time, working minimum wage part-time. I worked 3 part-time jobs when I was a kid. Teenager. And even then, I didn't make enough money to go out on my own. I still lived at home. I was just trying to put food on the table. But I raised this last week when DTD did their presentation on their goals, and I raised the issue about long range. Well, not issue, but if we're going to do long range planning, and this is one of our top goals, is taking care of keeping our families and people and our citizens safe, healthy, then we're going to have to take a more sophisticated approach about how we try to make the county affordable, and how we make living, the quality of life, a high quality of life where people can live and be safe and have less people that are vulnerable in those situations. That's not necessarily something we can do on our own. I think we're going to need the help of the legislature. We're going to need the help of other jurisdictions. But I think it's striking when you look at some of the studies of what the rents have been in the last 5 years and where the rents have grown. Whatever we're doing in this metro region, our rents are going through the roof, and it's driving people out. The number of people that used to live in the center of Portland that are now living out and farther east of Portland now, because the rents are more affordable. They're being driven out, they're being displaced, and they're being displaced economically. It's not because of their job. It's not because of the amount of money they're making. The rents are really what's driving this. So we need a more sophisticated, holistic approach to this, because I'm afraid the numbers are going to grow. I'm concerned about them growing. I don't want them to grow. I'm an eternal optimist, struggling in the position that I'm in today. But if the futurists are talking about artificial intelligence and what that will do to the job market, and perhaps losing 40% of the jobs that are currently out there today with automation, it's frightening, because that's not going to be. We don't have the means to deal with that right now. We can't even take care of what we have today, let alone a 40% loss of jobs. COVID has probably created some loss of jobs, obviously, and the forest fires probably had a load of impact, and we can rebuild out of that to some degree. But I'm just concerned that in order for us to achieve these goals, that we're going to need more help and a different approach than we have currently today to help solve it. I know you guys are doing the best you can with a limited amount of resources. That's got to be frustrating. And it's great to know that some of these measures have passed to provide more services, but I guess I would like at some point, once we have a better estimate of what those resources are and what the market we can do with those dollars in today's market, what can we actually accomplish? How low can we get those numbers? Can we eliminate homelessness? I know that there were people out there that were marketing the last measure, the supportive services measure, saying that it will solve it. I hope that's true, but I know that a lot of people are saying that that's not achievable. So I don't know where we land on that, but I know I've said a lot, but I'm just concerned because I think we all want to make sure that we're actually making progress on these goals and we're actually solving the need out there. And I want to see us do that and accomplish that, and not just have small progress, just inching along. We need, especially when the weather gets colder and things get more dire, we just need more action and more progress. And that's not a fault of any of what the work you're all doing. I'll stop there. And again, thank you both for your work, Brenda, as well.
Commissioner.
And Oh, Chair Schrader, I don't see any other hands.
Okay, great, because I'm going to ask a few questions too. And first, I'm going to thank you for all your hard work. I know you're on the ground uh, during some pretty troubling times. And I was really happy to see that, again, there's going to be a plan for the housing issues, homelessness issues in our rural areas, because that's going to be pretty significant. Because as you said, the dollars, some folks are going to be paying the dollars into the metro boundary who are living in these communities. And I want to make sure that even though the dollars might be flowing one way, but they're also getting the bang for their buck. So pretty much we can do what we need to do in their communities. So there's kind of fair and equitable treatment. And I've said that many times, so I won't belabor that particular point. But thank you for that. That makes me feel as if we're at least starting to think. Can you give me any specifics about what, well, first let me ask about Unite Oregon. There's 3 chapters. Okay, Multnomah, Rogue, and Washington. Which chapter are we working with? When we're talking about, you know, how we're going to be working, because we don't have a chapter in Clackamas County. Does this mean that we build capacity and get a chapter a year? Or are we working with Multnomah, Washington? I mean, what's the story with that?
Yeah, the Unite Oregon, sort of their leadership and their offices are in Multnomah County. They've expanded with kind of satellites with Washington.
Okay.
They are, you know, there are staff with them now that are dedicated to Clackamas County, that are Clackamas County organizers. This is the second time that we've worked with them in community engagement work. They're fantastic.
Okay, good. I saw that because I've heard of them before, and I hear that they're really, really good. And what exactly is the plan with the Coalition for Communities of Colors? Are they out in these rural communities right now, questioning and kind of taking a look at the demographics and, you know, the cultural kinds of things we're dealing with out there with Hispanic populations, Russian, so on and so forth?
Yes, they will be, Commissioner Schrader, in the first part of 2021. Right now, the work of Unite Oregon and the coalition is focused on engagement of communities of color within the metro boundary for the development plan. But once that is complete in December, early January, they will transition to phase 2 of their contract, which is engagement in the rural areas.
I'd really like to be kept up to date. I think all of our commissioners would be, because again, my thing is equity and inclusion across the whole county. Because particularly with the wildfires, I don't have to belabor the fact that people out there are pretty, yeah, we all know they're suffering out there. It's just been very difficult. Okay, so I have another piece I wanted to ask. I've been in touch with the folks that we have coordinated with to put our farm worker housing. You know, Maria, who they're kind of taking over the spot in Malala. Now there's land for sale evidently next to the housing they have there. Do we have a plan to help them if they want to somehow expand the number of units? Is that something that we're aware of, we've been thinking of? Because to me, if we're going to be working with those nonprofits, and they kind of get it out there. I mean, they're a Marion County-based organization, and they also do workforce training, believe it or not, teaching people how to manage properties. And so I thought they were pretty remarkable. Have we talked with them other than just handing over those, you know, the buildings we already have? Have we had done any further work with them, or is that something we should pursue if we're really going to, you know, try and get some of the rural folks, you know? So I don't know if I had a chance to talk with her. She said the land was for sale right next to the units that we have, are kind of handing over to them for management in Malala. So
Okay.
I don't know where that is. I think, Gary, I don't even recall if I told you about this, did I? Because if I didn't, I'm sorry, I apologize if I blindsided you about that. But those are kind of the opportunities that if we keep our ear to the ground, I think could be a really good opportunity for us. And the other question I have is, now we've just gotten Project Turnkey, at least a piece of it just passed. And that is really more for, I think, providing immediate and transitional shelter for people. Are we, how engaged are we in that Are we, I mean, I lobbied for it because it was an association of Oregon counties. It was a top thing that they were interested in.
Yeah.
And I know that Christine Drazen voted for it after a conversation. So are we kind of in the loop with that at all? And what's possible out here for our
Yeah.
metro, as well as our rural areas, you know?
Yeah.
Well, yeah.
Yeah, I mean, to your first question, Commissioner Schrader, I'm not aware of the land adjacent to the farm worker housing in Malala, so I would be interested in learning more about that, but I don't have any information about that.
I'll make sure I'll talk to Tracy after I get off of this call and make sure that
Okay.
I that information to you. But I've been looking at what they do specifically because they really are working with that demographic in a real on the ground, you get them housing and training way. So I'll do that.
Yep.
What about Project Turnkey? Have we identified?
So we have been, staff have been following that very closely. The emergency board did discuss it and they voted on it in 2 parts on Friday last week. And what passed was the $30 million that will go to the Oregon Community Foundation for the purchase of motels in counties specifically affected by wildfires. So Clackamas would be eligible for applying for those dollars. So we've had some staff are monitoring this. I'm looking forward to hearing from OCF about how that grant process is going to go. And I think that certainly we would want to pursue those funds.
Okay, so Brenda, have you done, I mean, do we have any motels or anything available? Do we even know what our capacity or what our?
Yeah, Vahid and some of our partners have been talking about motel acquisitions for a couple of years. There's a couple of potential owners who would be interested. I've been following this project a little bit, and in my mind, I saw the opportunity to, attain the asset through the Turnkey project and then follow through with the supportive housing dollars for the operations. Unfortunately, that plan might not work out so well if the only areas in the county that are eligible to purchase the motels are outside the urban growth boundary, then we won't necessarily be able to go in there with the metro dollars to support the operations. So I have not looked at what actually passed. I don't know if it's county-wide, so we can purchase a motel anywhere in the county, or if it's got to be sort of close to a burned area. So I think there's a little more research to be done there, because these dollars may provide a little bit of operations, but ongoing operations dollars are going to have to be secured from a different funding source.
And it may not, if it's outside of the metro boundary, then it may not be supported housing services. We'd have to maybe as part of the plan, then identify other providers or other capacity in the Malalas, the Estacadas, the Coltons, and all those other, and the rural centers then. So that's I imagine that might be part of a plan. And the other piece I wanted to ask is, we're moving all through this, how have we leveraged CARES dollars for housing as we work through our emergency operations centers? Are we accessing dollars? Are we gaining dollars? Are we maybe losing dollars? Are they falling through the cracks? Can you kind of give me a sense of that?
Sure, yeah. I can give you a little idea there. So the county received a little more than $3 million in CARES dollars that were allocated to the state of Oregon. Those were contracted out through the community action agencies for rent assistance. So right now, social services is deeply involved in the provision of rent assistance to individuals who are impacted by COVID. That's either an income impact or a health impact to COVID. We're working with Ant Farm up in Sandy, and we are well on our way to expending all of those dollars. We also have some, oh, go ahead.
No, go ahead. I'm sorry, Brenda.
We also have some CARES dollars from community development that are earmarked to support households who have been impacted by quarantine specifically. So those are the 2 CARES related funding sources that are currently, that social services is currently working on, specific to eviction prevention and homeless assistance.
So that's really been what we've been working through with our EOC then, is those particular things, but not any other kind of permanent housing. Okay. Well, that's,
Well, I should mention also the shelter system. So early on in the pandemic in March, we used some COVID dollars to secure motel rooms for houseless individuals. And we are working with the combination of ESG cares and FEMA dollars to ramp up we're calling it non-congregate shelter, which basically means hotel
Okay.
room. So we are working with the EOC. We hope to have as many as 300 motel rooms secured December through April to house houseless individuals, which is a real step above what we've been able to do in the past when we only had funding for a temperature-based winter shelter system. And that, sort of breaks your heart when it's 39 degrees and raining cats and dogs, and we can't open our warming shelters because it's not 33 degrees. So with these additional dollars, we're going to be able to provide a much more comprehensive winter shelter program. And then hopefully next winter, we will have access to some of the support housing dollars. So we'll have different opportunities available for houseless individuals next winter.
okay, thank you for that. This last question you can just get to me. I had it at one time, I don't have it now. I'd love to see who's on the continuum of care group, because that is really how we get our HUD funding, if I understand it. And I'm on at the national level on community and economic development vice chair, and we work with those HUD dollars all the time. So I just kind of like to refresh myself on how we get those dollars, how the decisions are made, and who are the decision makers involved. That would be really helpful. That's just a personal. And if other commissioners want that information, that'd be great. Okay, so I have no further questions, and thank you guys for everything. So
Commissioner Savis and then Commissioner Humbertson.
Yeah, just real quick on the topic of motel rooms, from talking to another commissioner in a different county. And I know that we've even explored it here and there a little bit. I've heard similar things in that, and that is that it's probably more practical to simply rent the motel rooms than it is to actually acquire the facility, because number one, they're not really either adequate as far as size or kitchen facilities or laundry room, that type of thing. So they're just not really designed that well for that, for permanent housing, if that's the goal. And the other complication of that is that obviously to remodel them is, terribly expensive. And I think most people would suggest that it's probably cheaper to buy land and build something than it would be to acquire something at a market rate, tear it down and then rebuild it. That's even more expensive. So, and that's in a more affordable county than the one that we're in. The other county I'm referring to is not in the metro region. So, anyhow, that said, I just want to I do think that acquiring the motel rooms on a rental basis is a practical solution, a temporary practical solution.
It also is a true economic driver for our communities. These are our motel owners, many of which have lost a lot of their businesses. Our dollars are allowing them to pay their lodging tax, which is another funding source for the county. So this, I see a lot of this work as really also economic development in terms of getting dollars into our local communities.
Yeah, and the last thing I want to say is that with all these different programs we've discussed here in the last hour, and some of them are short-term funding, one-time funding. I think what we need to really realize is what's going to expire when, and when does that funding stop, and then what's going to be the safety net, if you will. There's so much out there that it's probably hard to anticipate. And maybe our staff, probably who work more closer to this, are probably far more familiar to what to expect and when. But I think when we run out of resources, in a significant way, we're going to find a lot of people are going to be right the same place they are today or yesterday, and we're not any better prepared perhaps for that. And that's what I'm kind of concerned about. So I'm just kind of trying to understand what that impact would be when those programs expire. Of course, the bigger they are, the more likely we ought to be focusing on the big ones first rather than the small programs. But and hopefully we'll be out of the woods with regard to COVID by then as well. I'll stop there. I don't have much to add. Thank you.
Humbertson? And your mic is on, or your mic is off, I should say.
Of course it is. Just a reminder to Fahid that there is a motel that might be available in the Estacada area. Might want to speak to the mayor about that. I mentioned it once before. I'll defer to staff's expertise on cost benefit analysis, which is the better way to go. I understand that, you know, there's different ways of looking at it, but there could be an opportunity there. And then I believe Gary Schmidt's going to be sharing with you, if he hasn't already, a program in Anchorage, Alaska that is housing young people that have aged out of the foster system, that sort of thing. So you may want to take a look at that program and see if there's some brilliant ideas that we haven't gotten that they did and that we could steal. Okay.
And Chair Schrader, I don't see any other hands. I'm sorry, you're on mute, Chair Schrader.
So as far as I'm concerned, are we done for the afternoon?
We are done, Commissioners. Thank
Thanks,
you, staff.
Vicky.
Thank you, team.
Thanks. Yep. Okay. See you
Thank
soon.
you.
Job.
Thanks, everybody.